at primary care level at KK. So the concept of DPHSU is a family wellness concept. So it involves the identification of high-risk individuals and the formulation of strategies with emphasis on behavioral modification. So we will also involve the family of the high-risk individual. This concept will enhance good oral health practices within the family unit and in turn the community at large, thus ensuring positive preventive behavior in the population. The concept of prevention refers to identifying strengths and opportunities in ensuring success of intervention by giving consideration to oral health determinants and barriers, such as diet and nutrition, personal hygiene, tobacco consumption, and fluoride use. This is very structured, we say like risk assessment identification. So where is this unit? In Kedah, it is situated at this Klinik Pakar Pergigian Kota Star in Alor-Star, Kedah. Beside the PHSU, there's also other non-hospital-based specialty services here, namely restorative specialists, periodontic and orthodontic. The clinic officially opened since 17 September 2018. I remember this because it is one day after Hari Malaysia in 2018. Yes?
Hmm?
Can everybody hear? Okay.
Okay.
Okay. Since that, but the PHSU only commenced on 1st January 2019 because from that September until December, we still find ways how to implement it because it's very new concept to us. Okay. So since that, consulting services by the PHS are through visits twice a month. There's also one dental officer in charge managing this clinic and running of the clinic. And we have these two dental surgery assistant to help her. The location of the clinic is at Lebuh Raya Darul Aman, quite close to the old Alor-Star Hospital here at Kota Star District Health Office. This is the old Alor-Star Hospital, as well as near to Stadium Darul Aman. This is the photo showing the upfront of the clinic. You can see. Okay. So this is not a primary care clinic. So every patient need to be referred here, and we did not accept walk-in patient. This is the layout inside according to dental specialty inside the clinic is as shown in the slide. So you are neighbor to orthodontic specialist. Okay. This is the waiting room. Okay. So coming back to the PHSU, it consists of 4 rooms, the counseling room, 2 dental surgery and 1 dental health education room. Personally, I did not like this kind of setup, but it comes with the building, so I have to accept it. Slowly, I will try to rearrange this counseling room. This is the dental surgery one. Due to lack of budget, we still haven't got our dental chair here. So this is dental surgery 2 with dental chair cum unit and 1 dental health education room. The implementation of this DPHSU is guided by this guideline published by Oral Health Program Ministry of Health Malaysia in September 2019. So the general objective of the DPHSU is to improve the oral health status and quality of life of the community through family wellness concept using high-risk individuals as markers. While the specific objective is to conduct specific risk assessment for all referred patients, to conduct appropriate clinical preventive measures for patients, to provide behavioral modification counseling services to patient and family members, and to empower oral health self-care by focusing on family units as agent of change, and to be the center in conducting continuous training for oral health personnel in preventive intervention, and to be the center in providing expertise in conducting research. The scope of services are as follows. We did some clinical prevention, behavioral modification, oral health promotion, training, and research. So the clinical intervention may be conducted in combination with the other scope of services depending on the need. So based on the assessment of the patient, appropriate clinical preventive measures such as fluoride varnish, preventive resin restoration or facial sealant may be instituted. This is the clinical intervention. Okay, when it comes to behavioral modification, all referred cases will be assessed for high risk behavior prior to further management. Counseling for the identified high risk individuals and family members aims at internalization of positive behavior change in oral health practices. So primary socialization begins at home, and if established appropriately, community wellness can be achieved. For this type of services, I believe that the way we do consultation with our patients should use the approach of motivational interviewing, or in short, MI. So it is a client-centered counseling style for eliciting a behavior change by helping clients to explore and resolve ambivalence. I'm so lucky to have undergone a short course on MI under two awesome psychiatrists. There is Dr. Hazli Zakaria, President of Malaysian Psychiatric Association, and Dr. Muhammad Faiz Tahir, Senior Psychiatrist Lecturer from UIA. I learned a lot because MI is different from the traditional patient education. So we can see that before this, the typical patient education in the dental environment is typically clinician-centered and prescriptive in nature. We tend to tell our patient what to do. You should do this, you should do that, without considering his or her barriers, her determinants, right? So clinicians will, through this typical patient education, clinicians provide educational messages and direct advice using a unidirectional form. It's not two-way communication. It's just unidirectional form of communication to persuade patients to comply with professional recommendation. This put the patient in position of either passively accepting or alternatively resisting the often unsolicited advice. Factors important to the patient associated with change, for example, autonomy, intrinsic motivation, competence, connecting change with values and norms, perceived control, and readiness for change are not considered. Patient may perceive the advice as judgmental and intrusive, setting up resistance to change. So the third scope of service is oral health promotion. So we plan to establish this DPHSU as oral health promoting clinic, which provide promotional activities that can be conducted in a relaxed and conducive environment. This one, so far, I haven't implemented yet because due to certain constraint. So we plan maybe this oral health promoting clinic, the activities will include mini exhibition, video, puppet show, and interactive game. The next scope of service is training. We provide attachment preparatory program for potential candidates intending to pursue dental public health specialty, as well as training for other dental personnel related to dental public health. For example, dental therapists on clinical prevention, oral health promotion, and data analysis, and etc. I found that our dental therapists, they are really good at collecting data. In Ministry of Health, there's a lot of data we collect. Yeah, a lot of returns we collect, but sometimes our supporting staff, they are good in collecting stuff, but they cannot, sometimes the level of interpreting data is not there. So we need to guide them. Okay, the final scope is research, whereby the PHSU serve as one-stop center in promoting, supporting, and overseeing the implementation of research by dental personnel in dental facilities. So what about the patient management in the PHSU? Since the PHSU is a specialist care or secondary care, all patients need to be screened at primary care level before being referred to a specialist at the PHSU. We also accept referral from other dental specialty. So before we talk about the patient management in the DPHSU, I would like to bring us to see all the referral criteria before you can refer cases to the PHSU. These are the referral criteria for the PHSU. Patients have been classified according to age group from toddler until the elderly. So there are criteria that have been set. At primary care level, assessment of different type of disease and habit are done. And based on the assessment, for example, carriage risk assessment or CRA, if the results still high for 3 consecutive visits, then the patient should be referred to the PHSU. Same goes for BPE score or G score in order to curb periodontal disease. But I find it when I implementing it in Quarter Star, to get 3 consecutive visits in primary care is quite difficult. So I allow, I don't wait for 3 consecutive visits to have this CRA high. I told my officers in primary care clinic, if you got 1 cases, patient with CRA high, then she did some intervention at primary care level. Then the next visit, the patient didn't show improvement, then the case can be referred to me. Okay, this is for beginning lah, to make sure that I got all the patients. Okay. Okay, other cases like people with high risk behavior, such as tobacco usage, bitter nut chewing, alcohol consumption, or others, can also be referred to the PHSU. Next is the flowchart referral to the PHSU. After we receive the referral, risk assessment on the patient was done according to the type of referral. Investigation or tests will be performed if necessary. For example, a salivary test will be done if the saliva appears less or very concentrated. Once the patient is assessed through a risk assessment and undergoes relevant testing, then a treatment plan or behavior modification recommendation will be developed. Next, patient will be given customized dental health education according to the risk factors that are seen most to affect the patient's dental health. If the patient is present with the family, the patient's family will be involved together during the dental health session. If, let's say, the patient come alone on their first visit, we will encourage to bring their family on next visit. Okay, these photos shows the flow from patient assessment. Number 1, this number 1 is we're doing some patient assessment until the education on oral health as a group. Here, number 4. Okay, so this is we will empower each member of this family together, so then they know what their role within the family. We also observe how all members of this family brush their teeth. For example, number 3. After one sibling brush their teeth, we ask another person. Then we ask them to brush together. So they really enjoy this session. Really enjoyed using the toothpaste, how many toothpaste. They are like sibling rivalry, you know, who finished first, who finished second, and who got the most percentage of plaque score reduced. Yeah, that's really, this is a very, really enjoyable session for them. So by doing these activities together, we encourage family wellness, whereby family members are doing the practice of healthy habits to achieve better oral health. So I also, this is one family, right? This is the mother. Actually, they got one son. I think she got 4 children, 1 son and 3 daughter. But the son didn't come lah, didn't came for that visit lah. I can't remember why. I also call this family Cadbury family because the whole family really like Cadbury chocolate. Okay, it is a must-have snack in their fridge. So they don't mind having rice or anything carbohydrate on their lunch or dinner, but Cadbury chocolate is a must thing to have. That's why the younger sibling have this ECC number 2. Okay. So it is quite difficult to change the habits of this family. But I tried, and yet in the end they agreed to try to change the snacks to healthier options like nuts or fruits, right? But still nuts with chocolate, with Cadbury chocolate. They like to dip the nut with the chocolate, like strawberry cicah chocolate. This one like nut cicah chocolate. Okay. So, but very slowly, but they agree to me to change, right? Okay. Also for this family, by using sibling rivalry in terms of achieving plug score seems to be effective. For example, I let the elder sister first decide what is percentage of plug score for next visit, and the sister also encouraged her younger sister to do the same. So both of them have the same target to achieve and try to prove that they will achieve what they have targeted for. Alhamdulillah, for the next visit after I review, both all the siblings finally achieve less than 20% of plug score. Okay. Okay, so next is the assessment tool that have been used in the PHSU. We have this caries risk assessment adapted from American Association of Pediatric Dentistry, dietary assessment, salivary test, plug score assessment. Plug score assessment, I'm using this O'Leary index. So by using a more objective plug score, patients can self-assess their level of oral hygiene and give them the opportunity to determine for themselves the desired change target. Then for tobacco cessation or tobacco case, we use this phagestrom test for nicotine dependence and detection of carbon monoxide level using smokalizer. So this is the example of a caries risk assessment used in the PHSU. This is adapted from that American Association of Pediatric Dentistry. There are 3 parts. They are on general health, the clinical part, and also the contributing factor. Okay, this is the dietary assessment. So this is for 24 hours because in this caries risk assessment form, there's a number under the general health. Under number 4, we want to see how many sugar intake per day. So that this form is for 1 day. So we will ask our patient to record from the moment she or he wake up until she or he sleep lah. What breakfast, snack, maybe at 10 o'clock makan this tahu belau, and then air teh tarik and everything, dinner also, and we have now I smell the kway teow soup already. Okay, so we need them to really jot down. First, quite difficult for them because it's not routine, right? But when we do this and we teach them to do this dietary assessment, it really helped them to see that actually they really took their sugar intake more than 3 times per day. If you want to do on your own, on yourself, please do so. Now we know how many sugar intake per day we already consume lah for sugar intake. All right. This is the plug score assessment. I'm counting the 2 surfaces covered with plug, and my denominator is all the surfaces lah. So it's very very tedious, quite tedious, and it take time because you have to count all the plug for every surfaces. Then we count the percentage. From this assessment, we can see that this is the score plug here on the left side. So this target lawatan akan datang is for the next visit. So through metafunctional interviewing, I let the patient decide how many percentage you want. Let's say first visit, maybe 95%. Most of my cases for plaque, for referral for plaque control, most of my patients, their plaque score is more than 90%. Yeah, as high as 99%. So I let them to target. Maybe they say, oh, 70% doktor boleh. You rasa boleh tak? So macam nego lah. Negotiation. Okay. Okay. How you rasa you boleh capai berapa? So dia cakap, okay, I can, doctor, I think 70%. Okay, 70%. But you need to come often. Okay. So we target for 70%. We will check again for the next visit. This is the number of visit lah. Nombor lawatan 1, 2, 3, 4 lah. Alamak, hang again.
Frozen.
Okay. Dr. Wong.
Yes, frozen.
Frozen again.
Maybe you.
So should I stop sharing again?
You stop sharing and try again. It's okay. We are ahead of time, Dr. J. No problem.
All right. All right.
So if you all have any questions, kindly type into the chat box, right?
Okay. This is the plaque score assessment. Okay. This is the implementation status of DPHSU in Kota Star. So far, until July 2021, there's 118 new attendance, and the total attendances is 287 patients. So regarding the type of cases being referred, majority of the cases, about 74.6% were plaque control. Okay, I have only 5 cases for tobacco cessation. Out of these 5, I managed 2 of them have already quit smoking. Alhamdulillah, with help with nicotine patch and everything lah. Okay, so the combined cases ni, let's say for plaque as well as tobacco. Alright. So then for early childhood caries, I got 3 cases. Then I also got 1 dental anxiety control for only for 1 lah. But this she came with her family. And other cases 16, actually it is the family members of this patient, because we encourage our patient to include their family, and we managed to get their family to become our patient as well. So for monitoring and evaluation purposes, some of the output and outcome indicators have been set for each target group. Meaning that for each target group, these are the output indicators as well as the outcome indicators. So for example, the output indicators are the total number of patients attending the PHSU, and total number and percentage of patients receiving intervention, whether it's clinical or counseling. And the outcome indicators such as number and percentage of patients with plaque score less than 30% after intervention, number and percentage of patients quit smoking after intervention, number and percentage of patients with healthy gum after intervention. Okay, now we have come to the end of the slide. So the conclusions are, an organized and concerted effort is needed to identify and manage oral health determinants, and not only barriers, by giving personalized attention to diet and risk behavior modification. The family wellness concept being the core of the PHSU will be used to enhance the existing sensitization efforts in order to effect behavior change, and we hope ultimately a reduction in oral disease burden. So in short, the PHSU is about organized risk assessment. You do risk assessment proper, and a family wellness concept. With that, I would like to say thank you very much to all to have listened to me, or we to all, especially MADPHS, Prof. Tuti, for giving me this opportunity. Oral Health Program, Ministry of Health, specifically Principal Director of Oral Health, Dr. Nomi Osman, Dr. Fauzia Ahmad, Director of Oral Healthcare Division from Oral Health Program, since she's also the pioneer for this project. In 2019, she runs this clinic first before she transferred to Oral Health Program. And also, I would like to thank Dr. Mazlina Madesa, Director of Oral Health Regulation and Practice Division, on the effort providing the allocation. Got a allocation for the PHSU. And of course, Dr. Sharul Lai, Dr. Sharul Lai, for throwing all those provocative questions to me when I want to implement this. So why this? Why is this? Everything lah. He's like that. I don't know whether he's in the forum or not. And last but not least, Dr. Budi Aslini. Dr. Budi Aslini from Preventive Dental Clinic, Dental Faculty UiTM Sungai Buloh, for the inspiration. Thank you again. I'm sorry, Wong, it's quite short, right? My talk.
No. It's just in time because it's 1 hour. We can have more Q&A. Yeah.
Okay.
So, all right. Thank you very
Okay.
much, Dr. Jamaliah, for your very informative and comprehensive presentations. I'm
Okay.
sure the audience will agree with me that it was indeed a great presentations. Indeed, the establishment of Dental Public Health Specialist Unit, or DPHSU, is well justified and timely to promote family wellness concept in dental clinic. Because we do individual care if we still seeing patients in the clinic at the primary care. We also do a populations based strategy. That's what dental public health doing. And we believe that by having this family wellness concept, it will further strengthen the role of DPHS, or dental public health specialists, in improving the oral health of the populations. So, like Dr. Jamaliah mentioned just now, DPHSU is actually quite similar to the functions of FNS, Family Medicine Specialist. And this is something very unique for us, for the DPHS, compared to our medical counterpart, public health medicine specialist, because they can only sit in the office because they cannot see patient because they already have an FNS there. So they don't have a clinical component compared to us. And this is something that we should be proud about. We still, can legally go to the clinic with this function. So before we proceed with a Q&A, can we have a photo sessions as a memory? Because this is the best time to take the photo. So
this is
if
the
you,
best time. Okay.
because otherwise later towards the end quite difficult. So I kindly open your camera so
All
that
right.
we can have a photo.
All right.
Wait, just so those who have a camera, kindly open your photos, then we can take the photos. All right, thank you. Okay, I believe most of you have opened, so please please smile so we can take the photos. Don't leave yet because we still have Q&A, and also I still have a second page, maybe third page. So please continue to stay on. Second page, then one more page. Right, take the photos. Okay. Okay, still one more page. Those who haven't opened your camera, kindly open if you have a camera access. Actually, we have about 130 participants, so it's a good turnout for our webinar. Still got two more pages if I not mistaken. Right, we almost the end. Okay, so okay, we can proceed with our Q&A.
Okay.
So any questions from the participant, you can open your mic. You can open your mic, and then after that you can ask Dr. Jamaliah directly, and she'll be able to provide you the answer. Yep. So we open to the floor for the questions and answer.
I read the chat. I can see that Prof. Tuti was asking about what areas would you expect universities to provide emphasis in the training of DPHS. She got two questions. And how do you think best we can address health literacy issues in the population? Okay, for this expectation on universities to provide emphasis in training of DPHS, actually, I think we should combine maybe some module for the family medicine specialist, because we quite similar to family medicine specialists in KK. Maybe we can look at the module, because some of the module, because I think when I asked my family medicine specialist, they got this module on family wellness, and as well as the this motivational interviewing part or module, the way we interact with patient, the way we counsel our patient. Maybe that area can be emphasized more. Okay. And then the second one is, how do you think best we can address health literacy issues in the population? Because we need to um, we actually there's not only one way to address health literacy issues. We need to combine all the strategies, all the methods. Okay, one of it may be oral health promotion in a very creative way, and as well as sometimes we have to be in the trend, right? In the trend, some of the oral health promotion done using social media, I think that is very powerful, because of this COVID-19 information, right? There's a lot of misinterpretation, misinformation, and everything. So the thing is, the right authority need to be in trend with that, so that our people get the right information and not misleading information. Okay. Then is it? I'm answering your question, Prof. Tuti.
Yes, yes. To get the right information to the people.
Yes, yes.
Yes, yeah. And maybe sometimes we feel that the way we communicate with the public uh, are not clear. We
Yes,
actually need to go down to the level of making sure that people understand,
yes,
and
yes, true.
in communication, using the right words and things like that. Yeah,
Yeah.
I think
But
you got it right.
different
Yeah.
community, yeah, I got it. Right. But different community got different level of understanding. Like in Kedah, you cannot approach them through this really urban style, right? Because it's really customized to that particular community. For me, let's say we have this oral health promotion, we tailored to the group, because we have this WhatsApp group in the community, right? So we tend to uh, make videos according and tailored to that particular community. We send video to that particular community WhatsApp group, but we have to see whether it's sometime this, because in Kedah, like I can say for Kedah, we have this suburban or poor urban community, and sometimes we have kampung community. Yes, so we need to really customize the messages according to the community. You cannot produce one video, let's say video on messages, then we use that particular video for all. Cannot. uh, I think that really we have to produce something creative, and so that they can understand and they want to change. All right. Okay. Then the next one is from Dr. Azura.
Nazra.
The program of pemerkasaan perkhidmatan kesihatan bidang sekolah. The concept is also emphasis on family awareness, and most KPS are run by dental therapists. Can the JP refer all the high CRA student family members to the patients? Yes, they can. Yeah, this is not necessarily the referral from primary care je, tapi but from the school also can refer to the DPHSU. Okay. That is from Dr. Azura.
Dr. Azura.
Yeah. Okay, I can see Dr. Budi there. My inspiration.
Assalamualaikum, Dr. Jamaliah.
Salam. Yeah.
Dr. Zul, yeah,
Dr.
from
Zul.
ATM.
Yeah, yeah. Yes, thank you.
Thank you for agreeing to speak to us this afternoon. Just
Okay.
a small clarification. You mentioned in your talk just now that you did not like setup over there.
Yes.
So I have the idea of setting one in the armed forces. So probably you would like to share with us what will be your ideal setup. We start with a cabaret stall or something.
Okay. Okay. The idea is that we don't want that doctor set up, you know. That's why I'm sorry, I don't have the photos inside the dental health education room. Which the table, like I really like the setup with for example, the photo on that group family session. With the small table, the doctor is talking to all members of the family. I like that kind of setup actually. Yeah. But yes, please, we would like to see maybe in the ATM the kind of setup that Dr. Zul have mentioned later, maybe. Maybe I can share it later lah. Okay. Okay.
Right.
Hi, Dr. Jamaliah. Dr. Azliza here.
Yes, okay, Dr. Azliza.
Thank you for your presentation. As at least it's an insight for others that DPHS do some sort of clinical as well, because people think us do like all paperworks, proposal, lengthy of write up and stuff. So this is a good insight. I've got two questions. One question: when you say you treat the whole family, does it mean that the whole family will be treated at DPHSU, or you refer them back to primer? Will you do like complete cases for the family members as well? That's number one. And number two, can you share a bit on, I'm quite interested on one of the patient was referred because of the dental anxiety. If you have any, can you share a bit on that particular patient? Thank you.
Okay, thank you, Dr. Azliza. Yes, we treat all family members at DPHSU as one whole family. We did not refer back to primary care. We don't want these cases to become like bola, hantar sana, hantar sini. We don't want that. We want to change that kind of perception. If we treat the patient as well as the family, so that the whole family got the concept of family wellness, so they can practice their good oral habit, so that it become a norm and a lifestyle for that particular family. So in this, this family will form the community, right? So that's why we treat all. Okay. The second question on the dental anxiety, actually it come by like ad hoc, that dental anxiety actually, her mother is the patient. Her mother is the primary patient. Okay. Then when her mother is under orthodontic. Okay, under orthodontic from restorative, from restorative for plaque control. Okay. Then when she always come with her child, this 7-year-old child. And when we ask a mother to come, then we said to her lah, come and sit. Come and check. Main lah check gigi. Oh, nangis. Very anxiety. And we asked the mother why. Because this child had an traumatic experience at previous dental clinic. Because when they check her, one of the handpieces macam terkena sikit lah on the lip, I think. That's why she become so traumatic on the event, and she very anxious. When she saw the dental chair, she cried already. Not even enter the room, saw the dental chair, cry already. Then we said, never mind, let her cry, okay, in the dental education room. Sit there, let her sit there with all the toys and everything. Then the second visit, when her mother came, we asked again, and we try to make sure that she familiarized with the new environment at the DPHSU. Then after, I think the third visit, finally we managed to get her on the dental chair. Okay, this is quite challenging for me lah, because when we were at primary care, we have to manage also children, right? So this kind of case, we try to help the mother as well as the child as one family. Okay, Dr. Azliza?
Yes, thank you very much for your explanation.
Okay.
Any more questions from the participants?
Yeah, one more,
Yeah.
Jamaliah.
Yes.
This is regarding the manpower, the operational part of it. You said that you don't have a permanent specialist. Are you the only
Yes.
one there, ataupun you rotate among all the public health specialists in Kedah or the whole of Northern macam mana?
Okay, I'm only rotating in Kedah because there's another dental public health specialist at Kota Star District. I'm at state level. So we rotating ourselves. Last time when Dr. Fauzia was here in Kedah, she also rotate with me. Then she transferred to Oral Health Division. I'm alone. So it's quite challenging for me. I'm very challenging because I'm at the state level doing all these desk officers work and this planning at the state level. So I have to divide my time accordingly. So but I have this permanent dental officer there to manage, to make sure that she list all the patient one day so that I can see all. So that this is a very planning, and we have to plan properly so that I can still go down to the clinic as well. I'm doing my job at the state level lah. Okay, we really hope that more DPHS will be from the university. We want DPHSU, DPHS, we want DPHS to come and join this DPHSU lah. Okay.
Right. Thank you for
Okay.
the answer. I hope can answer the Dr. Zu's questions. Any more questions from the participants?
Assalamualaikum, selamat tengah hari.
Hari.
Dr. Jamaliah.
Ya, siapa?
Dengar ke? Saya Dr. Farid.
Ya, Dr. Farid.
I just want to ask about MI lah, Dr. You
Yes.
mentioned that
Nampak
you
lah muka Dr. Farid. Boleh tak video?
sorry tak siap lah di rumah.
Bukan nak tengok rumah, nak tengok
Blur.
muka.
Blur the background.
That's alright. Yeah.
Okay.
Okay.
I just want to ask about MI, Doctor. You
Yes.
mentioned that you gone for a course with psychiatrist, Doctor.
Short course. Yes.
Short course with psychiatrist. So,
Yeah.
did they provide you with a guideline or macam template for the MI?
Okay.
And can you share a little bit your experience on using MI and also normal OHE, chest OHE? Macam mana perbezaan, Doktor? Nampak perbezaan tu macam mana? Thank you,
Okay.
Doctor.
This is that course or bengkel lah. I think bengkel. This MI conducted by these two psychiatrists. They have got modules. Some modules they have got modules, but then they train me to use it, but I cannot train other people. Okay, I'm this MI is client centered. The normal counseling session, doctors tend to prescribe things to their patient, right? Like let's say a patient have this, for example, I got this case of high plaque score, right? We tend to say to the patient, okay, you ada 100% plaque score. Lepas ni you kena berus gigi 2 kali sehari. This is prescription nature of us. We were trained like that, right? You kena buat macam ni, berus gigi 2 kali sehari, floss, then kumur, jangan makan gula, something like that. We tend to prescribe, but we don't, in motivational interviewing, we ask them, okay, how, sekarang ni kita, let's say we have to use this plaque score assessment. Yeah, for example, let's say now you got 95% score. How do you feel? Do you think it's good? We want to initiate the conscious to change from inside the patient. The way we ask question is different from the normal counseling session. Through this motivational interviewing, we want to invoke or we want to provoke inner change from themselves. Okay, so it is like we want to help patients to explore on their behavior, why they want to do that, why they cannot brush, let them ask and let them give whatever suggestion that they can do to change. Okay, and then is there any specific course available for it? There is a course actually if you want to be trainer, but I'm not so sure. But the thing is, these psychiatrists, they are well trained in this MI because they got this kind of different type of patient yang memang psychiatric kan. So psychiatric lain sikit lah kalau you nak cakap orang psychiatric. So kalau kita different dia tu sebab kita minta perubahan tu daripada dia sendiri. Itu beza dia. The way we ask question different daripada normal counselling session. So if you want to know more, please nanti kalau ada any MI punya course, banyak MI punya course. And in fact ada one book in US, I think US punya terbitan, especially on dental punya motivational interviewing. Yeah, I can remember the title. Adalah buku tu. Okay, Dr. Farid?
Thank you, Doctor.
Okay.
Thank you.
Okay. From Susan. Susan. Thank you for sharing. How do you conduct smoking cessation for patients? Do you use the trans-detector model? How long did it take for the patients to quit smoking? Okay. Okay. Actually, for this patient also, I'm practicing motivational interviewing for this tobacco cessation. And how long does it take? It's about, I think, 6 months. 3 times. That patient have to come for 3 visits. After 3 consecutive visits, then when we do the smokalizer test, normal lah. The first one to heavy smoker. Then after I review after 2 weeks. Then after 1 month. Then after 3 months. And after 6 months. Then finally, because I asked them to pick a date to quit. Because I said, when is for this patient, I remember one of the patient, I asked them to pick a quit date concurrently with his wife anniversary. So hadiah anniversary dia untuk wife dia adalah quit smoking. So we have to, through MI, we try to find all factors yang related to dia punya personal belief, to dia punya environmental belief. So this I hope will encourage them to change lah. Okay? Okay, Susan? Susan to everyone.
Yes, doctor. Thank you so much.
Okay. Quite challenging. It's not easy to do behavior change. Okay, siapa lagi ni? Oi. Sekejap. Siapa? From Rose. Okay. From Rose. Okay, I hope you don't mind some question. Okay. Okay. As we are actively covering the few overlapping aspects of public dental health and deliveries in KP, albeit not in a very detailed way, how do you know it's time for intervention by the PHSU? Okay, this one is if you refer to my referral criteria, okay, there's a referral criteria. If you, let's say, for example, school children with when for example, kotak program. I know some of the dental officer in primary care officer did kotak program, and then they fail to advise to do some intervention yang conservative punya intervention, right? You fail to do that. Bukan you fail, patient fail to quit. You are not failing, okay? I'm so sorry. But then you can refer this kind of patient to the PHSU for kotak program, okay? Due to big population as we go down the pyramid, how does the PHSU see itself expanding closer to reach every level of the community? So actually, this is I think the approach from down we maybe you can see in public health we can say lah sometimes people don't like this kind of approach, and this approach is downstream punya approach, not upstream punya approach. So kalau you but bila kita guna this approach, we involve the family. That's why we nak family tu yang akan mempengaruhi, yang akan make up the community. Okay, so we start slow, we may be new, but we hopefully after that, after few DPHSU is all over the country, we hope that we can finally get the population at the population level. Okay. Okay, thank you for nice sharing, Dr. Jamaliah. For DPHSU, does specialists need to have CSSP license for smoking cessation clinic? Yes, we recommended that because I have CSSP license and my clinic is certified by CSCSP. Okay, so I think this training on CSSP is all going kan for all the country lah. Each state, I think, have already at least officers involved in Kota should have CSCSP. Okay, Rose?
J.
Assalamualaikum warahmatullahi wabarakatuh.
Salam. Siapa
Dr.
tu?
Jamaliah, Dr. Naziah here.
Yes, Dr. Nazia. Yes. Lama dah tak dengar.
How are you?
Fine, thank you. Quite
I
nervous when I
would
saw
like to
you.
congratulate you for a very
Yes.
inspiring presentation.
Yes.
I can hear the very passionate voice, you know. You're very passionate about this. And
I'm passionate about everything.
and actually this topic is very close to my heart.
Yes.
We started doing this, I think, in 2018, but I was not there long enough to see it take off. And
Yes.
I'm glad that finally it took off.
Yeah.
And I really hope that it's going to be all over the country soon.
Yeah.
It may start off in Kedah, but perhaps other states should also be doing it, I think.
Yeah.
But as you mentioned just now, I think I mean, I don't have a question actually, just a few comments. Where you said that you attended courses to equip yourself.
Yes.
So I think this is a very good start where our DPHS, you know, should equip yourself so that you are in the position to carry out your role and function, you know, in this unit. And the other thing I would like to also congratulate Prof. Tuti for having you on this platform, because it is a good platform where we can sensitize all the DPHS, and so that we can really know the you know, the role of a DPHS for the you know, particularly for the oral health, for the betterment of the oral health for the nation. So congratulations again, Dr. Jamaliah.
Thank you, Dr. Nazia.
Thank you, Datin. It's all efforts by our members juga lah to have this session.
Yeah,
Okay.
I'm sorry I could not put on the camera because I'm not ready to be you know, to be
To be seen.
yeah, being retired, you know.
No,
Yeah.
it's okay.
It's okay, we know you.
Yeah.
Assalamualaikum dan selamat
Salam.
sejahtera Dr. James. Dr.
Yes.
Syamil. Wah, dengar ceramah you tadi tu semangatlah pula nak mulakan
DPHSU. Yes.
Johor, dan
Please.
I also miss
Oh, why? Oh, suddenly no.
It's a connection problem, Dr. J. We will be
Okay,
taking
alright.
the last questions because we are approaching 2 p.m.
Anybody
J,
want?
Dr. J, actually,
Anybody?
there's one more questions that you haven't answered just now.
Oh.
In the middle, never mind, I read it for you because you answered
Okay.
part of it already by
Okay.
Dr. Farid. This one is by Dr. Liana Muhammad Azhar. She's
Okay.
asked, how do we conduct motivational interviewing and how is it different from normal counseling session? I think we answered that. And then
Yes.
part 2 of the question, is there any specific course available for it? I think I leave you to answer for her. Thank you, Dr. J.
Okay. Specific course, actually you can find it lah online, but I don't think because this course actually an effort also from Oral Health Program, Ministry of Health. Okay, from there lah. That's why I try to get into the course lah. But then if you want, you can ask some people at Ministry of Health, the unit latihan baik biro, can ask them lah where is the motivational interviewing punya course lah to equip yourself lah. Okay? Okay, then
Okay.
there's Diana ni
Yeah, last questions.
Okay. Thank you. Regarding the kotak program, I support it need to be done silently at school. Yes, okay. To avoid reluctance from patient, how the referral should be done as parental consent will be needed for this. Okay, we actually this is one of the issue lah for kotak program. Yeah, we have discussed about this. We said that the patient can come to the clinic, but actually this issue haven't been resolved yet lah. Because if the patient under 18 years old have to come to the PHSU, he or she have to come with the parents, right, for the consent. I understand the question. So for the time being, we haven't find the solution yet for this issue. Okay, we will update you lah, Diana. Diana maybe primary officer kan. So I think for this parental consent we will discuss later. Okay, thank you.
Okay, Doctor. Thank you.
Okay.
Thank you. So this is our last question. So thank you very much, everyone, for your very overwhelming questions. Dr. Jamaliah, I think you spent half an hour to answer the questions, half an hour to give a talk. It's perfect combination.
I need questions so that can activate my brain.
So if you all have any other burning questions, I think you can contact Dr. Jamaliah, or maybe email Dr. Jamaliah to ask if you have other questions, because we are at 2 p.m. now, because some people need to go to do other things. So I would like to end the session. So dear Dr. Jamaliah, we are very grateful, thankful to you for such an enlightening and interesting presentation. So on behalf of the MADPHS 2020 to 2022 Council, we would like to thank you, Dr. Jamaliah, and all participants of this webinar for taking your time of more than 1 hour, I think, to attend this webinar. Not forgetting Dr. Annie and our other MADPHS Council member who worked tirelessly behind the scene for this to happen. So please find the attached link for the evaluation form and also e-certificate. For your e-certificate letter, we will close it by 3 p.m. So kindly also type your name correctly. If you type wrongly, then your certificate name will appear wrongly. So for your information, there will be 4th webinar, which will take place in the month of October 2021. So please stay tuned to that and follow our Facebook page for the further announcement. So with that, we thank you for your time attending these sessions. So you may leave now if you have other commitments, because for the council members, I think we will stay back for photo session. Maybe we invite Dr. Jamaliah to take photos with us.
Okay.
Is that okay, Prof. Tuti? Yep. Yep. So
yes, sure. Thank you, everyone.
Usually, if we do it physically, so there will be a lot of photo sessions taken on already. And now we have to find a way to do it. Dr. Jamaliah, do you have other meetings coming up at 2:30 or 2:15?
No.
Okay, yeah.
Okay.
Yep, good. I think the timing from 2 to 2 p.m., 1 to 2 p.m. just nice. Because last time 12:30 people still at work.
Yes, agree.
So 1 to 2 p.m. we find that people most of them can join. So I think our next sessions will make it 1 to 2 p.m.
Maybe Dr. Jamaliah boleh share email ke for anyone who want to ask the question. Dah ni ya?
Ada dekat chat box, I think.
Alright.
On the chat box.
Tak perasan.
No.
Ada ke?
Ada. Okay, again.
Share lagi sekali doktor. Ada yang termiss.
From the response, I can see that people are very happy with Dr. Jamaliah's presentation. Alhamdulillah.
Yeah, there's a lot of good comments. We will archive it and then
Wong,
yes,
regarding the cert, where is it? The link?
there will be a special cert for you.
Oh, okay.
There will be a special cert for the speaker because you get
We
different
will
mark.
email you, Dr.
You're not getting
Of
one
course.
mark only.
I expect my certificate will be laced with gold outside and everything. I
Boleh
like to exaggerate
diusahakan.
things. Okay.
Okay, I think I think our council member can open the photos, the video. Okay, I have managed to save all the comments. Maybe I will send to the J for you to look at it.
Yes.
To email to you. So I think we
Yes.
get all our council member to open your videos. I mean the camera so that we can have a photo. So I think all the council members should be around now. I look at it. Yeah, all the council members should be around. We just take the photos. We just take one photos before we leave because it's already 2:07. So everyone get ready. One,
Where's
everyone
Dr.
ready?
Zul?
Ready? Dato' Zu.
Datuk mana Datuk?
Hello, Dato' Zu.
Tak ada dah kot.
Ada.
Dia pergi tengok vaksin center.
Sorry, Imam.
Tak ada.
You asking me something?
Baru nak berumpat.
Dato', can you
Yeah.
open your camera? We have a
Oh,
group
okay.
photos
Hai.
with our speakers. Hey.
Okay, siapa lagi tak
Right.
ada?
Okay, we take
Wan.
photos. So 1, 2, 3. Okay, we take another. We take now because Dato is all taken.
Okay, thank you very much.
Lupa pakai tudung.
Annie, especially.
Tak ada apa doktor.
Thank you very much, Tom, Amy, and all, Prof.
Good job,
Thank you
Dr.
very much.
Thank
Jam.
you.
Okay.
See you
Thank you,
next
Dr. Jam.
webinar.
Dah expert
Okay.
Thank you,
sekarang
Dr.
buat.
Jam.
Bye. Thank you.
Thank you.
Sama-sama. Welcome.
Okay.
If COVID
Thank
dah
you.
habis, if COVID dah habis, we would like to welcome to come to Alostar and see the clinic at the unit. Okay?
Alostar.
Alostar.
And pergi Pekan Rabu.
And pergi Pekan Rabu. Lepas tu terus pergi Langkawi.
That sounds cool.
Thank you, Dr.
Tak sabar
Jamaliah.
nak pergi tu.
Okay?
Okay, thank you.
Thank you very much.
Pinangan.
Okay.
Thank you everyone.
Tajuk
Okay, boleh
dia kena betul.
leave. Tajuk kena betul. Alostar. Okay.
Okay.
Okay, bye
Bye-bye.
everyone.
Take care
Take
all.
Bye everyone.
Tajuk kena betul. Okay, bye. Hang budak saya punya ni.
Happy birthday to the Haslina.
Nak nyanyi lagu happy birthday ke?
Boleh juga council members nyanyi lagu. Tak ada jumpa secara bersemuka.
Still have people, 33.
Oh, maybe dia orang pergi lunch lupa tutup kot.
Oh, well, now we know. I think I think most of the people, I think all the council member leaving. I think we shall leave now.
Yeah. Try to leave also. Okay, bye.
Bye. I think Dr.
Kena
Annie,
halau.
bukan kena halau.
Tak apa. Saya tunggu sampai pukul 2:30.
Yeah.
Pokok ada yang nak guna link tadi tak nampak, tak
Yes,
dapat
yes,
link
yes.
lagi tadi.
We'll stay back for any Q&A for the certificate.
Tapi tak apa Wong, kalau you nak leave dulu.
It's okay, it's okay.
Standby.
I want to save the comments for the J. I think that's it.